Hey there, mama. Have you ever found yourself crying for no reason after having a baby? Maybe you're more anxious than expected, snapping at your partner, or wondering why everyone else seems to be adjusting while you're just struggling to get through the day. If so, this video is for you. Here's something really important. Not every emotional change after birth is postpartum depression, but not every emotional struggle is just hormones either. The difference really matters. Today, I'm going to break down the difference between baby blues and postpartum depression, the key symptoms to watch for, who is at higher risk, and what you can actually do right now to support your mental health. I'm Dr. Jessica Poulin. I'm an OBGYN and maternal-fetal medicine physician and a mom of 4. This is one of the most common concerns I actually see in the postpartum period in my clinic, so let's talk about it. Question: why does this actually happen? One contributing factor is a hormonal shift. One of the reasons your postpartum emotions can feel so incredibly intense is that there's a big hormonal shift that happens after delivery. During pregnancy, estrogen and progesterone hormones are at an all-time high, much higher than normal. And then within 24 hours after delivering your placenta, those hormones drop dramatically. When you layer all of those things on top of your sleep deprivation, physical recovery, feeding a newborn every 2 to 3 hours, and the emotional transition into motherhood, whether it's new motherhood or adding additional children, it becomes really clear why this period feels very overwhelming. These hormonal changes don't necessarily cause postpartum depression all by themselves, but they definitely contribute, especially when women actually have underlying risk factors from prior to pregnancy. So what are the baby blues exactly? Baby blues are really common. They affect up to 80% of women who give birth. That's 8 out of 10 women. Usually, baby blues start within the first few days after birth. They peak around day 3 to 5, and then they resolve usually in about 2 weeks. Common symptoms include tearfulness, mood swings, irritability, feeling overwhelmed, having anxiety, or emotional sensitivity. One moment you may feel like you're okay, and then the next moment you may start crying over something very small. And I want to talk to you about something being normal here. This is frequently a normal response to a massive hormonal shift and life transition. The key distinction is this: baby blues do improve over time. They don't progressively worsen. So when might it be just a little bit more than baby blues? Postpartum depression is different. It's more persistent, it's more intense, and it's more disruptive to your daily functioning. Symptoms of postpartum depression can include persistent sadness or emptiness, loss of interest in things that you normally enjoy, feeling disconnected from your baby or other important people in your life, excessive guilt or shame, hopelessness, significant anxiety, changes in sleep or appetite, or feeling like you're failing as a mother despite the fact that you're actually doing a good job. One important thing many women don't realize is that postpartum depression does not always look like sadness. It can also show up as anxiety, irritability, rage, and emotional numbness. Many mothers that experience postpartum depression are still functioning. They're taking care of their baby and managing life while silently struggling deep on the inside. The key difference is the duration and impact on functioning. If symptoms persist beyond 2 weeks, or worsen instead of improve, that's a signal that you need to be evaluated and get more support. Strongest risk factors include the following: a history of anxiety or depression, a history of postpartum depression after a prior pregnancy, mood symptoms during the pregnancy, traumatic or complicated birth experience, NICU admission or infant health concerns, pregnancy complications like preeclampsia or gestational diabetes, relationship stress, financial stress, significant sleep deprivation, and lack of social support. I also want to talk a little bit about one thing that is often overlooked as a risk factor, which is being a mother without an actual mother. So whether the loss of your mother is due to death, estrangement, or lack of availability, the lack of maternal support in your life can often intensify feelings of isolation while you're trying to recover postpartum. Having risk factors doesn't mean that you for sure are going to develop postpartum depression. It just means that you should be more intentional about support and mental health during this transition period. Question is, what can you do before baby to optimize your mental health? And let's talk about what actually helps. These are not treatments for postpartum depression. They're not the same as medication, but they certainly can support emotional resilience and recovery. So before baby arrives, please prioritize sleep as much as possible. Sleep is kind of an emotional buffering before the postpartum period. Please try to identify someone to help you out for after baby comes. If you have a history of depression or anxiety, discuss it with your OBGYN ahead of time so you can have an action plan in place. And then what can you do after delivery? The first thing is sleep whenever you can. I recognize this can be challenging. I've been postpartum 4 times myself, but even short rest periods matter. Sleep directly affects your mood regulation and anxiety levels. The second is nutrition. Anti-inflammatory diet can support mental health and energy stability. So please focus, ladies, on vegetables and fruits, beans and legumes, whole grains, nuts and seeds, olive oil, fish, lean protein. If you're not on the Mediterranean diet, please get on it yesterday. Number 3 is hydration. This is especially important if you're breastfeeding. Even mild dehydration can worsen fatigue, irritability, and brain fog. Number 4 is movement. Even a short daily walk can improve mood and reduce your anxiety. Number 5 is social connection. Isolation is one of the strongest drivers of poor mental health in general, and in particular of postpartum distress. Small conversations or check-ins really matter, even via text with a distant friend. Number 6, sunlight and time outside. Natural light helps regulate sleep cycles and supports your always certain symptoms that should be taken seriously and prompt a visit or a 911 988 call. And those symptoms are thoughts of harming yourself or someone else, thoughts of harming your baby, feeling like your family would be better off without you, inability to function in daily life. These are medical symptoms. They are not personal failures. Postpartum depression is highly treatable. The most important message is this: you do not have to wait until your postpartum depression becomes severe to ask for help. Takeaway from today's video, it's this: baby blues are temporary. Postpartum depression is persistent and deserves support, and you do not have to go through this alone. If this video helped you, let me know in the comments what postpartum topic you'd like to discuss next, and if you're comfortable, what your experience was with postpartum depression or baby blues. And subscribe to the Vital Femme MD podcast for more physician-led postpartum education. Take care of yourself, mama. I'll see you in the comments.